Okay, so we're going to be talking about hemophilia, which is a genetic blood disorder. So, in this disorder, people are either going to be missing their factor VIII or their factor IX clotting proteins. So, if a person is missing factor VIII, that means they have hemophilia A. If a person is missing factor IX, then that means that they have hemophilia B. So, basically put, if a person is missing either of these clotting proteins, their blood is not going to clot. And so if they get injured or if they're in a situation where they might be bleeding, they're just going to continue to bleed. And this is bad because if your blood's not clotting and you keep bleeding, you're either going to die or you're going to be seriously injured. Okay, so let's talk about the risk factors for this disease. So as previously stated, this is a genetic blood disorder, and the gene for hemophilia affects the X chromosome. So because of this, the disease affects males way more than it affects females. So to kind of show a little diagram or figure here, I came up with a scenario that shows a couple people. So there is Pam, and she's a carrier for hemophilia, and then there's Matt, who doesn't have the disease at all. So let's say that they get married and they have a kid, little Timmy. There's really only two possibilities for little Timmy, and that's either that he gets the disease or that he doesn't because of that X chromosome. Okay, so let's further this scenario. Let's say little Timmy, he grows up and he marries Wanda, and they have 3 kids. So here's kind of the potentials for the disease. Their 2 sons aren't going to get the disease because Wanda's X chromosomes are going to come in. She doesn't have the disease. They're good. They miss it. But let's say they have a little girl and her name is Sally. She's going to become a carrier for the disease because her dad is going to give her that X chromosome that has the disease. So it is important to kind of side note that just because hemophilia is predominantly genetic, that's not always the case. Kind of like any medical process, like there are those kind of like rare instances where a person doesn't have hemophilia in their family, and they still end up with the disease. It's usually just a mutation on one of their genes, and it does happen. It's really rare, but it is kind of just like a little important tidbit to put in there.
In order for us to fully comprehend what hemophilia does within the body, we must first understand some general concepts such as blood coagulation. Blood coagulation, or blood clotting, occurs as a response to a broken or damaged blood vessel, which would cause blood to leak out of that vessel. It starts with vasoconstriction of the blood vessel. This occurs to prevent blood flow to the area as to prevent excess blood flow from leaking out of that broken blood vessel. Next, platelet aggregation occurs. Once the vessel is damaged, platelets begin to congregate at the wound site and bind to the collagen fibers in the surrounding area. And after this platelet aggregation occurs is when the actual blood coagulation or clotting occurs. This is where things typically start to go wrong for people who have hemophilia. The coagulation process, also known as the clotting cascade, involves 13 different proteins known as clotting factors, which activate one another in a chain reaction that eventually leads to the activation of fibrin. The activated fibrin forms a loose mesh around the area, which eventually becomes a dense cluster of fibers. It's here in this dense fiber mesh that passing red blood cells will get caught, forming a blood clot over the platelet plug which was formed. And this will prevent the escape of blood from that broken blood vessel. Since people with hemophilia are deficient in clotting factors, specifically clotting factors 8 and 9, their bodies are actually unable to complete this clotting cascade. So if even so much as one single clotting factor is missing or deficient from this clotting cascade, the blood will be unable to clot properly. And this is what we see in people with hemophilia. Their blood doesn't clot properly. So having this proper understanding of some general concepts and the underlying themes of blood clotting with patients with hemophilia can help us understand how it actually affects the body at the lowest level, and will give us insight into how we as nurses can formulate a proper care plan for our patients.
So as Sam previously said, people with hemophilia are lacking the clotting factors 8 and 9. And because of this, they are not able to clot their blood when they get an injury to a blood vessel. Fortunately for them, there are treatments that can be done through drug therapy. Oftentimes they have to go every day. Sometimes people can go once a week. It really varies case to case depending on their clotting factor labs that come back or how active a person may be. So for people with hemophilia A, there are drugs such as Advate, Hematate P, and Xanthina. Hemophilia B have alphaphene, bibutylene, and monophene. You can find more drugs in the Lewis textbook on page 627 if you want to look into it further. But for these therapies, they temporarily replace the clotting factors that are missing. And if the person is to hurt themselves, they are able to clot and they don't have to worry about bleeding out. Like I just said, oftentimes kids who play sports will get this done more often, just so that they can play without being in fear and they don't have to necessarily worry. Another time is when a person with hemophilia goes to the dentist. They will often be asked to get their drug therapy right before. That way, if their gums do bleed, that nothing will happen. There are some clinical manifestations that a patient should know about. A major one that there is more complaints about with hemophilia is that they have hemoarthrosis, which is bleeding in the joints. With this comes a lot of pain and discomfort. So for these patients, pain is kind of number one for treatment. Other indications of hemophilia are bruising, major bleeding from minor cuts such as paper cuts or from brushing your teeth. There is bleeding in your stool that could be a sign of internal bleeding, and blood in the urine. It's very important that we educate our patients on what signs and symptoms to look for. I think most people know what bruising looks like or what to look for on externally, but for internal, it's not as easy. Not everyone knows what to look for in bloody stools. They need to know that they need to be looking for darker brown, black, that tar-looking stool, or looking if they have coffee grounds in their stool. That could be a sign of bleeding. So it's very important that as nurses we educate them with hemophilia what to look for and what to expect.
Hello, everybody. As my classmates have mentioned before me, hemophilia is a genetic disorder that puts our patients at risk for bleeding excessively due to the fact that they do not produce clotting factors as we do. The most common clinical manifestation of hemophilia is hemophthirosis, which is basically bleeding into the joint spaces. This is often very uncomfortable and painful for our patients and can sometimes debilitate them and make them bedbound. Other indications that our patient might be suffering from hemophilia is frequent and uncontrollable bleeding after minor injuries or dental procedures. Also, frequent bruising and possible blood in the urine are other indicators of this disease. Patients should be educated to watch for signs and symptoms of bleeding, especially internal bleeding, because that can be potentially very harmful for our patient. When treating this patient, our biggest priority is to monitor the patient's pain using our PQRS tool. Finding out where the patient's pain is located might help us determine if they have hemophthirosis or not. Our patients also need to make sure that they are getting all of their proper medications that are ordered by the provider. As my classmates have said before me, their clotting factors, their pain medications, etc. Our third priority for these patients is to monitor their labs, paying attention particularly to the patient's PTT, as this is a big indicator of the patient's efficiency of the intrinsic clotting factors. As a nurse, there we are the main people who are participating in the direct care of these patients. But there is a whole specialized care team of healthcare providers who help treat this patient. Some of these people can include a hematologist, which are healthcare providers who specialize in different diseases of the blood and the blood components. Other specialties include social work, who help assist patients in issues that they may have after going home from the hospital in their day-to-day life. They help them locate resources, help them find infusion centers, and can even assist them in transportation to and from those appointments. Physical and occupational therapy also helps in assisting the patient to exercise and how to exercise properly to prevent further injury. They also can help in rehabilitating a patient who might have previously been bedbound and help them gain their strength back. And other specialties who might be involved in this patient care can also include, surprisingly, an orthopedist who specializes in disorders that often affect the bones and the joints. As all of these specialties work together, we can educate the client and the family, and these patients are able to live a long, healthy, happy life.
Which of the following are clinical manifestations of hemophilia? Select all to apply. A. Nausea. B. Bruising. C. Excessive bleeding. D. Dry skin. Or E. Hemarthrosis.
The answer is B, bruising, C, excessive bleeding, and E, hemoarthrosis.
Hemophilia is characterized in patients by A. The platelets' inability in the body to aggregate properly. B. High amounts of thrombin activity in the blood. C. The body's deficiency in particular clotting factors. Or D. A high volume of fluids in the blood.
The answer is C, the body's deficiency in a particular clotting factors.
Which of the following statements from a patient with hemophilia indicates a need for further education? A. I will use a soft bristled toothbrush when brushing my teeth at night. B. I need to be careful about someone coming in contact with my blood so I don't pass it on to them. C. I will use an electric razor when shaving. Or D. I will not be able to play contact sports.
The answer is B. I need to be careful about someone coming in contact with my blood so I don't pass it on to them. So as Sam mentioned before, a major part of the blotting.
Okay, so let's start talking about